In case you missed it yesterday, the Department of Health and Human Services and CMS have announced who is on their Healthcare Advisory Committee. This is the group responsible for giving ideas and helping out RFK Jr. and Dr. Oz with making decisions about your healthcare. You will be shocked who's on it. Like, I could give you 100 guesses. You'll never get it right. So stick around to find out exactly who I'm talking about. Hello, everyone. I'm Zachary Freeman, and today we're going to be going over some groundbreaking news that just announced yesterday that directly affects your healthcare. So yesterday, the Healthcare Advisory Committee was announced, and you might be asking, why is this such a big deal? Well, the answer is right there in the name. They are there to advise Dr. Oz and RFK Jr. on, and I quote, ways to improve how care is financed and delivered across Medicare, Medicaid, the Children's Health Insurance Program, and the health insurance marketplace. RFK Jr. could be quoted saying, this administration is bringing leaders together to tackle the challenges facing American patients and the healthcare system, putting prevention front and center. Secretary RFK Jr. can also be quoted saying, this committee will help us shift from a sick care system to a true healthcare system by delivering practical solutions and drive real change. Dr. Oz can even be quoted in the CMS article that says we received overwhelming response from highly qualified candidates across the country. These members bring deep expertise across care delivery, financing, innovation, and patient engagement. Their insights will help us advance higher quality care, reduce administrative burden, and strengthen the sustainability of our programs while supporting efforts to transform our healthcare systems and restore stronger focus on patients. So far you may be wondering, why am I making a big deal of this? Well, let's dive into it. CMS has stated, in their own words, this committee is comprised of leaders from across the healthcare system. Leaders from across the healthcare system to provide expert advice on improving, strengthening, and modernizing U.S. healthcare. And for the most part, when you look at this committee list, that's true. I mean, let's look at the list of committee members that I'm going to pull up on your screen right here, or right here, depending on how the video edit goes. So on this list, you have Robert Bessler, MD. You have Kimberly Brandt, who is the Deputy Administrator and COO of CMS. On this list, you also have Stephanie Carlton, who is the Chief of Staff and Deputy Administrator for CMS as well. You have names like David Carmouche, MD, Clive Fields, MD. You have Q Ray, MD, who is also a former CMS innovation leader. There's also Dennis Laraway, who is the current Vice President and CFO of Cleveland Clinic. That is just a list of few of the 18 members. And while I'd love to do a deep dive into every single one of these for the sake of time, I'm not going to do that. You can pull them up yourself. The list is right here for you to do your research. All that being said, there is one name that I have not mentioned yet. That name is Anthony Robbins. And nope, not the Anthony Robbins who was the former director of U.S. National Institute of Occupational Safety and Health from 1978 to 1981, but this Anthony Robbins, or as you may know him, Tony Robbins. Motivational speaker, author, net worth of $600 million. They stated there was over 400 applications and somehow we got Tony Robbins. And I'm not here to take sides. I'm just here to give you the facts of what's happening. Because, I'll be honest, I'm not educated enough on what he's done to be in this position. That I know him. I remember seeing videos of him on a stage yelling at people to be better. I am not here to belittle any decision, and I am not here to take any stance whatsoever because it's not my place to. My whole purpose is to be here to tell you who these people are that are going to be making decisions on your healthcare and directly affect you. At the end of the day, do I think it would have been nice to have somebody from the health insurance side or the agent side who deals directly with talking to you face to face and seeing what you as a healthcare recipient gets as far as deductibles, co-pays, max out of pocket, premiums? Yes. However, it's not my position to take, and I don't come up with these committees. So these are the people who are directly going to affect your health. Do your research. look up information. And if you have any comments, opinions, I love to hear them. Put them in the comments below for me to read. And this is just breaking news brought to you by me, and I'll see you in the next one.